Aloha and hello. My name is Corinne. I'm a certified clinical hypnotherapist, and I get asked about 4 or 5 times a week, how the heck do you get to do that? I mean, who would choose to be a hypnotherapist and why? So I figured I'm going to do a video and I'm going to talk about that today because it's really pretty fascinating. It might seem odd to some people, but for me it made a lot of sense. I was in the medical field for many years, and I know I look very young, but I actually graduated a couple years early from high school. I started going to college when I was still in high school, and I was really pumped. I wanted to be an MD. I wanted to save people. I wanted to help people, and ended up when I really had more experience in Western medicine that I started learning a lot of the truths. I started learning a lot of the science behind these things. So today I would really like to talk about what knowledge I gained from being a pharmaceutical technician and working hands-on in the pharmacy at a very young age. I started reading a lot of things. I started reading the package inserts, the full prescribing information for drugs from the pharmaceutical company. You have the right to ask for this, by the way. So this will come folded up in any drug or vaccine or anything like that. And you can always ask for that, and it tells you the ingredients, it tells you how it's been tested and things of that nature. But the main testing process and the main thing that I want to talk about today is that the scope of practice of a medical doctor, and that is to prescribe drugs, pharmaceuticals, and sometimes to do surgery if that's their specialty. So I started looking into the pharmaceuticals, and I was very excited because I really, at the time, it was new, exciting technology, information, and drugs were going to save the world, and everybody was really pumped about that. And then I started reading these things and started learning that there was some extremely, extremely toxic ingredients in there. And I started asking questions. What the heck is this doing? Why is there thimerosal, which is mercury? Why is there formaldehyde? Why has this not really been tested? Why are they not testing any of this to see if it causes cancer or mutagenic properties or impairment of fertility? And there's so many toxic things. Well, I started to learn how our drugs are tested. And this really made me just, whoa, back off everything and take another look, because when you're going through med school, and you get to be a doctor, you have to take an oath, and that's the Hippocratic Oath. You take an oath to first do no harm. I was incredibly excited to take that oath, and when I learned about how prescription drugs are tested and approved for our use, I really was disgusted and didn't understand. I thought it was completely asinine because we have what's known as the LD50. Okay, I want you to share this with anyone that you know that's in the medical field, because this is something we've got to start looking into. We've got to start researching this. It's known as the LD50. That's the letter LD50, and it's all the LD is in capital letters, and this stands for lethal dose 50%. Okay, the median lethal dose. This is how we actually test prescriptions. So I'm going to let this sink in for a second. We cannot, the FDA cannot approve something, quote unquote, approve it, and your doctor cannot prescribe it to you unless it can kill you. The FDA cannot approve it. Your doctor will not prescribe it unless it can kill you. That, to me, seems so counterintuitive from what I'm wanting to do from first do no harm. Let's help people. Let's heal people. Let's, get well. And then the lethal dose, 50%. So what that means is it's basically the lethal concentration of a toxin, a radiation, or a pathogen, and the LD50 is the dose required to kill half the members of a tested population, usually within a certain amount of time. So like the LD50 30 would mean the lethal dose 50% at 30 days, or the LD50 60 would be the lethal dose 50%, cut it in half, right? Get your lethal dose, find out what kills, cut that in half, find out what it kills half of the population, and then, at 60 days, what's gonna do that? What's gonna accomplish that goal? So it has to kill you, and that just still blows my mind. So I really decided that that wasn't what I wanted to do, and that it made sense to me how come every time that I would see patients coming back in to the pharmacy or into the doctor's office that I worked at, every time I saw them, they were worse. They were worse off. They looked worse. They felt worse. They weren't doing well. They had new symptoms. They were all these other things that were happening, and that became very depressing because I was in the healthcare field to see people get well and to see them thrive. And I myself was very sick as well at the time. So I started looking into this and really researching what this all means. And by the way, the word doctor actually means teacher in Latin. So if your doctor is not teaching you and teaching you about health and teaching you about your body and educating you about how to achieve balance and to achieve health, if your doctor's not teaching you, any of these things, then you gotta find a new doctor. You gotta find a new teacher. Okay, that's really important, and you can teach yourself a lot of these things. So the package inserts, the full prescribing information, this is where a lot of the damning evidence is, and this is also where a lot of the knowledge is. So you can always ask for these. This is your legal right. And what I learned from this is the placebo effect, which is really amazing, because the placebo effect is the ability for our minds to incorporate things as medicine or as health or as healing. Our minds can do this, even when the effect of the medication is nil. So I started really researching that because I thought, why are we not delving into the placebo effect? There's no toxicity to it. Which I just said it, there's no toxicity to it. They don't want anything to do with it. This is why the FDA cannot approve vitamins, supplements, marijuana. They can't do these things because there's not toxicity levels enough to be able to say, okay, this killed half the population, now we know what dose to hand out to everyone else. There's no toxicity level with it. So the placebo effect, it's non-toxic and it's damn cheap, and there's all these other things about it that were super intriguing to me, and I started to delve into the psychological realms and aspects of things, started to understand with my studies, from then on, when I went into natural, I guess you would call medicine, and clinical hypnotherapy and learning, all of these amazing skills and tools, that our bodies have all of the ability to heal themselves and to do amazing, amazing things if we'll allow them to and if we'll let them. So when we can learn about our emotional states and how that affects us, our stressors, our daily stressors, and we can learn about how these things affect us on a daily basis, when we can learn how the food that we're putting in, the things that we're putting in, the water that we're using, the food that we're using, the things that we're putting on our body and our skin and all these things, when we start to kind of mesh all these things together, people can have miraculous differences and feel extremely healthy where it's so fast. So the placebo effect really boggled my mind, and from then on, the rabbit hole kind of opened, and I got sucked down even further. So I am very excited to share science and knowledge and information with you guys. And again, forward this video to anyone that you have that's in the medical field. I think it's important that we start questioning the LD50, the whole testing procedure, how we go about testing things to give to people, and that there must be a lethal dose to be able to do that. This is something that's really worth taking a second look at, and for anyone that is in the medical field that is in it because we want to help people, because we're empathetic and we want to help people, and we really want to help you help yourselves. So that's from my point of view, and that's why I do hypnotherapy and NLP. I use essential oils because I like to help people help themselves. Send me any of your questions that you have. Please continue to question, continue to research. We're not gonna get there unless we are holding ourselves accountable and we're doing the research and learning on our own. So thank you so much for your time. Thank you so much for listening. And please, feel free to reach out. And this next year is going to be a phenomenal year for so many of us that are learning and growing and progressing. And I look forward to sharing that with you and sharing more tools and more knowledge with you. Aloha and many blessings. Thank you.